Major depression is a very common illness in the population. We know numbers as high as 16% of the adult population will suffer a major depression at some point in their lives. In fact, today, 35 million people are going through a depression. As common as major depression is, many people unfortunately still do not receive treatment. And what I'd like to do is try to go through what the common presentations are, what to look for individuals, loved ones, family members, workers, friends who may have depression if those individuals are not functioning in a way that they should because of their depression. Now, let me go back just to the epidemiology a little bit. Despite the fact that we have many effective treatments for depression, and by the way, this is a very exciting time in medicine because the number of treatments that we have, combination treatments, are just escalating. Despite that, though, we do know that depression still has significant morbidity and mortality if it's not adequately addressed. And I personally, as a psychiatrist, believe depression is among the most treatable illnesses we see in medicine. And so if someone does suffer from depression, it is important for them to really go for true remission. And I look at depression as though someone may have cancer or an infection. The whole goal should be getting rid of all of the symptoms, and that is what remission is. Because we know failing to get rid of all of the symptoms, similar to if they had cancer or an infection, is probably the greatest predictor that someone may not do well. And yet, depression, I believe, is among the most treatable illnesses that we see in medicine. For any individual who suffers from a mood disorder or depression, the expectation should be nothing less than full remission of all symptoms. Now, that may mean that the individual may need to remain on treatment for extended periods of time. And for some individuals, if they've suffered 2 or 3 episodes, that may even be the rest of their life. But similar to any other illness, the expectation should be remission and what we call ultimately recovery. Now, we know that if an individual suffers from major depression, and if they're better, but they're not fully remitted, that there are a number of risk factors or other bad things that can happen. We know that they obviously have a higher risk of getting sick again. We know they're at risk for getting other medical illnesses, whether they're cardiovascular diseases, metabolic diseases like diabetes. They're at risk for having other illnesses show up. They're also, if they have another illness at the time, which depression very commonly coexists with other illnesses, those illnesses could get worse as well. We do know that depression impairs one's ability to function, and it shouldn't have to. It can impair their ability to work and their relationships with people, younger people who may be in school. It can have severe impact on their life. We know that depression is associated with a risk of suicide. Unfortunately, that risk can be as high as 15% of the population who suffers from depression. That is preventable. That can be preventable by just intervening and getting the right treatments. However, if someone does get the right treatment, that risk still exists. And if someone is not adequately treated, they still have symptoms, that risk of suicide may still persist. There has been some recent data that was funded by the National Institute of Health, and this was a very large national study that looked at the general population with depression in primary care as well as in psychiatric settings. It basically showed that the majority of people, when they first get treatment, don't do so well. Basically, about 63% of the people failed to achieve remission on their first treatment. And this study took people step by step through a number of treatments, including psychotherapeutic interventions. And it showed as you went farther along and you got into your second, your third, your fourth treatment, your likelihood or your chance of remitting got less. And so the idea really is to get treatment early, have it treated with whatever it's going to take, with all the variety of treatments we have available, whether they're medicines, psychotherapeutic approach, other psychosocial approaches. People need to know that adequate treatments are out there for them.